We are here at EACVI teaching course in Belgrade, multimodality imaging in cardiovascular care. I have a great pleasure to speak with Professor Flashkampf from Uppsala University, Sweden. Welcome, Professor, to Belgrade, and thank you for your time to answer our questions. First, I want to ask you, as one of the co-authors of the book Emergency Cardiography, can you tell us who is your targeting audience for reading and using this book?
Yeah, our audience is perhaps in the first place cardiologists, but since emergency echocardiography nowadays is done by many people, I think it is a particularly useful and very rich book. And it's certainly also useful to intensivists, people in emergency rooms. Nevertheless, obviously, the main target group are cardiologists.
We are witnessing an increasing trend of using cardiac ultrasound and point of care, such as focus protocol. Would you say that value of focus protocol is integration of ultrasound findings in clinical context?
Yeah, clearly cardiac ultrasound is very, very powerful and has a lot to offer, even for not necessarily cardiologic problems. So the patient that comes in with dyspnea or with syncope or hypotension, these are all very good indications to do an emergency ultrasound. The catch, though, is that this needs training. This is not easy. Ultrasound imaging is not an easy technique. And to really harness the full power, you need training. So as long as training is assured, I think it's perfect if everybody acquires some competence in ultrasound.
Are there some focus questions that we need to ask ourselves during the examination due to obtain enough amount of information from that exam? What should we ask ourselves?
Well, we should think clinically. Obviously, it depends on whether you have a patient, for example, with hypotension or a patient with chest pain. You should always think clinically and have a sort of look at the pre-test likelihood. What might I encounter in this case? What am I looking for?
How much do you think events such as this one impact everyday clinical practice of cardiologists and other physicians?
Well, I cannot answer this for this country, but I think you have a very reasonable group of people here who are European experts in the field, and I think it's a very good opportunity also to for everybody to check their knowledge against let's say the experts' knowledge or the current state of knowledge. And I think this is a good thing. This is not going to change the course of the world, but I think this is a very useful congress.
Okay. And the last question, what advice would you give a young person interested in career in cardiology? What should be our priorities?
This is, as we said, a difficult question. I think you should make sure that the environment where you work is interested in you. And if the environment where you work or your chief or your colleagues are not interested, and if you do not feel appreciated, change this environment. Go elsewhere. It doesn't have to be another country, but perhaps another institution. So do not stay if people don't appreciate your work.